Hello, this is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel. Today, I will be introducing to you the star of the show, which is our Vaser machine. Okay? This is the Vaser 2.0 system. Vaser means vibration amplification of sound energy at resonance. So vibration amplification means it is a third generation ultrasound assisted lipo. It is the ultrasound, the ultrasonic that the Vaser emits that actually melts out the fat. So that when we do the lipo, there will be actually less bruising, less swelling, less pain, smoother results, and faster recovery for the patients. Let us introduce to you to the different parts of the machine. This is actually your infiltration system. So when you put the IV here, it measures the weight of your IV. So when you actually inject the fluids, you would actually know how much you're actually infusing in. This is a pump over here. So it turns around when you step on it, and then the fluids from here actually go into the patient. This part here is the suction part. This is actually the infusion. So the infusion, you are guided actually depending on how much rate you want. You can do as low as 50 ml per minute infusion of your fluids. If you want fast infusion, usually go with the 400. If I want slow infusion, if the patient is actually awake under local anesthesia, I do it at 100. It's the amount of pressure that the suctioning actually increases. This one increases depending on how much suction pressure you actually need. This is the Vaser amplifier. Okay, you have the V and you have the C. Okay, V mode is actually your Vaser mode. This is actually your intermittent mode. Okay, the C part is actually your continuous. C you use it for hard areas, okay, the back, other parts of the body when bigger area. V mode is actually your gentler mode. So you use this for smaller areas like your face, when you actually go very superficial. So this is actually the amount of power that you want to put into your machine. Okay, so when actually you do a superficial part, which is actually usually the face, you go as low as 40 or 30%. And then when you actually have a bigger area, want more power, you can go as 80 up to 90%. This is the timer that when you actually emit, when you're actually using this one. Now this top here, this is actually your Power X. There it is. Okay, that is your Power X. This is the power assisted lipo of the Vaser system. Okay, most of the power assisted lipos are actually through and fro movement, like that. Okay, so that you can actually go through hard areas. This one is kind of different because it doesn't go that way. It actually goes circular. So it's like a drill, no? Instead of a jackhammer. Okay, the others are jackhammer. This one is actually a drill. It actually goes through tissues gently. So when you do the Vaser, it's actually already melted out. And then when you do the Power X, you just actually need to suction out more of the liquefied fat. So this is 360, 180, depends on the rotation. So this is rotational, okay, the angle that you want. This is the RPM, number of rotations per minute that you want, okay? Again, this is the time that you consume while doing your Power X, okay? Okay, I already compared this one with the other forms of power assisted. Usually the one that's I was telling you about. I love this one better. I don't know if it's just maybe I'm just too used to Vaser that I cannot actually think of other machines to use. I love this one. This is actually your canister. So this is where the fat comes in and actually collect the fat. This is for disposal. Okay? You don't actually use this to harvest your fat. We have a different and separate sterile canister for harvesting the fat. Later, we will show you how it is in action. So hang on to that one. See you later. We're doing fat grafting today for our patient. We're going to be harvesting it from the abdomen and then transferring it to her hips and to her butt. So the first stage, okay, is actually harvesting. Okay? When we harvest, definitely we need to do a lipo. In any form of lipo, you still need to do your tumescent solution. So we're actually doing the tumescent, infusing the tumescent fluid intra-abdominally into the subcutaneous tissue. This is the pump, okay? So we have a 752. This is the tumescent fluid. It goes to the machine, it goes to the pump. When we step on it, see, the numbers going up. Okay, so now I actually know how much fluid I am infusing into the patient. So after this, you're going to be doing the Vaser. Later, I'll show you that. Then after the Vaser, we're going to be doing the suctioning. We're finished now with the tumescent. Okay, so when you actually press, see, it's actually firm and turgid. These are your skin ports. These are actually used to protect the skin from maceration from the heat coming from the Vaser and actually the multiple movements coming out from suctioning. Here's your amplifier. This is your probe. Okay. So the ultrasonic actually comes out here. Your skin port, we insert the probe, We step on the machine. If you hear that, okay, so that is the one that's actually your ultrasonic. And then you just go through and fro so that you can actually release the skin from the deeper subcutaneous tissue. And as it goes along, it's actually melting out the fat. Then after this, we still do the suctioning. Now you would ask me, Doktora, kung isa-suction din naman pa, if you're still gonna be doing the suctioning, then why melt out the fat, okay? So the really nice thing about this is that when you actually do the melting of the fat or the emulsification, the fat actually becomes very soft. It's very easy to aspirate or to do the suctioning. And in that case, there will be less trauma. At the same time, there will be much more complete evacuation of your fat. Especially also for this case, this is actually a repeat case already. Kumbaga nagpalipo na siya before. Tissues become hard because of the previous fibrosis. So the ultrasonic actually goes through the old fibrosis so that you can actually do a cleaner swipe. Mas malinis, mas complete. And at the same time, when you do a superficial melting of your fat, you can actually make the skin contract. This time of doing the emulsification is actually an additional step. Because usually, when you do traditional lipo, you just tumesce and then you actually suck. Okay, this one, you tumesce, you emulsify, and then you suck. So the second stage is actually an additional time. However, the melting of the fat is compensated by the suctioning time. Kasi when you do the suctioning time, it's actually faster and more efficient. See this part here? That's milky, milky, milky coming out. That is actually your melted out fat. So actually now we're finished with the vaser. Next step is actually suctioning. Now with the suctioning, okay, we're going to be using the Power X system. As I mentioned earlier, this is quite a different form of power assisted. While most power assisted lipo like vibrates in the tip, this one is actually rotational. So that is actually your movement. So basically it glides gently into the tissues. Okay, so we are harvesting fat. See here, the fat is going through there and into our fat harvesting canister. See? After this, we're gonna be washing the fat, okay? Making it separate, transfer them to syringes, and then we inject. We're almost finished doing the lipo here. This is just one side, okay? So if you can see how thin, and this part is still the big part. So this one is starting to take shape. This one is still big. Okay, we still need to thin this out. This is still a little bit thick. Plus the insides, okay? The deep fat, we still need to take that out. We're finished with the suctioning now. Okay, she's starting to take shape. We already thinned out the lipo. From earlier, the thick one, now it's actually a lot thinner. We give her some definition. And then we'll work on the hips, the butt, and then we'll flip her over. Okay, so now we're going to be doing some fat grafting first for the hips, and then later to the butt. That's it. Very thin. Thank you. To watch more videos, please click that button down there and don't forget to like, comment, and subscribe to the Fat Sucker channel. And again, this is the Fat Sucker, Dr. Claudine Roura saying, see you in our next episode. Bye-bye.